Hi there. Thank you for joining us for episode 10 of the Mazars Healthcare Digest videos. Today, we will be talking about the California Provider Appointment Availability Survey, or PAAS, and some recent updates. My name is Scylla Outcalt. I am a director with the Healthcare Consulting Group, and I oversee all of our regulatory survey projects.
And I'm Sunshine Strong, a manager with the Healthcare Consulting Group, and I manage the survey processes.
So today we will start with an overview. We will then talk about the measurement year or my 2022 survey methodology updates for PAAS. We will also be discussing best practices for PAAS as well as a conclusion. So to get started, let's talk about PAAS kind of at a glance. So the California Knox-Keene Act requires health plans to monitor and maintain networks that are sufficient to provide enrollees with access to covered healthcare services within specific time-elapsed standards and to meet certain network adequacy requirements that are set forth within this Knox-Keene Act. By March 31st of each year, health plans are required to submit to the California Department of Managed Healthcare, or the DMHC, a timely access compliance report, which includes information related to monitoring and network access, as well as network rates of compliance for each time-elapsed standard during the previous year. In order for these rates of compliance to be able to be compared across all the health plans as part of this timely access compliance report, the health plans are required to survey their network providers to assess the time frame that providers give for their next available appointment using the DMHC's standardized methodology. This survey is referred to as the Provider Appointment Availability Survey, or PAAS. Over the years, PAAS has continued to evolve and change, but one thing that has not changed is the DMHC's continued interest in the survey, how plans are executing it, and the results that it yields. This interest really is evidenced by the enforcement action that you can see here on this graph that has been applied over the years to timely access. And something of note is that these enforcement actions have ranged from $1,000 all the way up to $1.5 million. This year, a number of changes to the PAAS methodology have come out. And so with that, we think that it's a good time to talk about what's new and also to revisit some tried and true best practices. All right, so after much anticipation, California's Office of Administrative Law has accepted new regulations related to timely access, which will take effect April 1st, 2022. So what's changed? Well, the most significant change in the methodology for MY 2022 is the establishment of a rate of compliance. So a rate of compliance really is something that's always been calculated and presumably reviewed by the DMHC, but up until now, there has not been a specific threshold set. However, starting this year, the rate of compliance is now 70% across each network for both appointment types, urgent and non-urgent. Additionally, the DMHC has expanded the types of specialist physicians that are now included in PAAS. So in prior years, cardiology, endocrinology, and gastroenterology were the types of specialist physicians included. But starting this year, we will include not only those three, but also the specialties listed in blue here. So dermatology, neurology, oncology, ophthalmology, otolaryngology, pulmonology, and urology. So in terms of executing the survey, there have been some other changes. So the sample sizes that were established in measurement year 2019 will continue to be used, but now there's going to be a requirement for the sample size in each county to be achieved, unless the sample size can't be achieved because of ineligible providers. Also, the network capture date has shifted from December 31st to January 15th. And additionally, the DMHC has provided some more details about what information specifically they're looking for to be included in those PAAS quality assurance reports. Another area where we've seen changes is telehealth. So in particular, DMHC has removed the telehealth or kind of virtual county. Additionally, related to telehealth, when beginning surveys, providers should now be informed by surveyors that they can respond with in-person or telehealth appointments. However, if when giving appointment dates and times, a provider doesn't specify that appointment type, surveyors should ask whether the appointment date and time is for an in-person or a telehealth appointment. Finally, for providers that are listed as providing both telehealth appointments and in person, the results, according to the DMHC, should be recorded to the physical location of the provider. We'll say all of that said, given the confusion that exists around current language related to telehealth, we do anticipate that the DMHC will likely provide a lot more guidance in the area of telehealth. So keep an eye on those DMHC FAQs regarding telehealth. So as well as establishing a rate of compliance, plans will now need to develop corrective action plans or CAPs for networks that do not meet that 70% threshold. After 3 months of implementation of the CAP, plans will have to submit an amendment to the department to demonstrate their compliance. Also, these new regulations include some more details about the quality assurance processes that plans are expected to have in place to monitor timely access and network adequacy on an ongoing basis. Outside of PAAS, there are some other notable changes. So advanced access, which applies to primary care providers, needs to be verified every 3 years. A verification process can be incorporated into the credentialing and re-credentialing process. Also, the enrollee experience survey is addressed, including a requirement now to evaluate enrollees' experience with interpreter services. And lastly, the provider satisfaction survey now has a requirement for the evaluation of the provider's experience with the plan's language assistance program. So now that we've covered these significant changes to the methodology, I'm going to go ahead and turn it over to Sunshine to remind us about some best practices when conducting PAAS.
Thank you, Scylla. That was a lot of really good information. The importance of planning really cannot be understated when it comes to the success of PAAS. Anticipating pitfalls and moving to mitigate them before beginning can make the survey process much easier. Ensuring that all relevant stakeholders are involved in the planning process is of particular importance. Provider relations and networks should be active participants in identifying and mitigating issues before you begin, along with your data and outreach teams. For example, one pitfall is failure to consider all scheduling conflicts or challenges. What are some of the vacation plans of your project team? Get out that calendar and look at which holidays fall within the planned survey outreach. There may be additional days that are not considered by the DMHC to be holidays that your medical groups observe. Take all of these into consideration when planning your outreach waves, and mind the gap. Double check and check again that your schedule allows enough time between your waves to be compliant with the methodology. When building your contact lists, a common issue we encounter is the inclusion of providers affiliated with FQHCs and RHCs, which is not appropriate under the DMHC's methodology. Make sure your crosswalks are up to date and complete. Take time to proactively mark providers that are no longer eligible for outreach due to leaving the network to simplify your contact lists. During the sampling phase, pulling an insufficient oversample is a common issue. This can be avoided by using all providers not in your primary sample as oversample. In counties that have previously had low response rates, you can consider moving to a census method rather than random sample to ensure that you are surveying all of your providers that are eligible. Again, preparing before survey outreach is essential. Failing to adequately and effectively train survey staff is an issue that can have a negative ripple effect throughout the whole PAAS process. Your training should include role playing to allow surveyors to practice answering common provider questions. Through these scenarios, stress the importance of sticking to the DMHC script and only providing allowable clarification. Include questions that have come up in prior years that have required research and time to answer, or are common stumbling blocks for your outreach team. To avoid non-compliance with your survey tool, compare the survey tool line by line against the DMHC guidelines before outreach, and have more than one person review the forms for this verification. To avoid errors in formulas, it is critical to review these formulas multiple times and involve more than one person when verifying. Ensure that your formulas calculate appointment times down to the minute. SQL will often round minutes by default and can cause issues with rates of compliance if not updated. Additionally, when testing your formulas, we recommend choosing a variety of example days and times. Choose various days of the week and times of the day. Be sure to try dates that will span a holiday and thoroughly vet the accuracy of your formulas. It is important to monitor and analyze the survey responses throughout the collection process. By reviewing real-time survey responses, you can catch errors as they happen and retrain surveyors if needed. And finally, it is critical to document how you implement the methodology throughout the process, particularly any choices that were made that may warrant explanation to the DMHC. Similarly, if you identify any departures in your adherence to the methodology, it's important to maintain documentation of these issues as they occur so that they can be reported as applicable. For example, if there were groups missing from your crosswalks, you want to ensure you call those out and have them added before you submit for the measurement year. I'm going to hand you back to Scylla for some conclusions.
Thank you so much, Sunshine. So in closing, we want to share a couple things. So number one, stay vigilant about the changes to the methodology. There's a number of them, and be sure that they are captured throughout your PAAS and other survey processes going forward. Also, really be diligent about reviewing the DMHC's FAQs and be sure to keep an eye on any changes that will affect you and your organization. As we said, keep in mind these best practices that we talked about today that really can have a significant impact in making PAAS go smoothly. And if you get stuck, don't hesitate to reach out. We are always happy to help. With that, we'd like to thank you very much for your time today. And as mentioned previously, we're always here to help. Feel free to reach out.